Assalamu alaikum wa rahmatullah. Our article for this week is a prospective clinical trial study titled Well-Being Post-Operative Pain and Outcome After Clinical Application of a Novel Root Canal Irrigation Fluid (RISA) in Teeth with Apical Periodontitis, a first in a human study. It was done by Martens et al. In the International Endodontic Journal. First of all, the apical periodontitis is the inflammatory response to microbial infection of the root canal system. Several studies have been demonstrated that large areas of the root canal system remain untouched by the root canal instruments, and therefore irrigation of the prepared root canals with chemicals is an important step in reducing the endodontic infection. A new irrigation solution which is RISA, has been devised and developed to improve both disinfection efficacy and the biocompatibility, and has been previously described and referred to as modified salt solution. It's a hypertonic solution of mostly sodium chloride with added potassium sorbate in water with a pH of 6.8. So the aim of this study was to assess the tolerance to the new root canal irrigation fluid RISA after root canal treatment by evaluating the subject's post-operative well-being, post-operative pain, and treatment outcome. For the methodology, this study is the first clinical application after a series of in vitro studies. 16 subjects, 17 teeth, followed the inclusion and exclusion criteria. They were diagnosed with asymptomatic apical periodontitis. The endodontic treatment was done in a single visit using RISA for root canal irrigation. For the clinical procedure, the pulp chamber was filled with RISA after the orifice is enlarged with the orifice opener. Each root canal was irrigated with 1 milliliter RISA with a flow rate of approximately 0.2 milliliter per second. And also after each instrument, the canal was irrigated with 1 milliliter RISA. Then after the completion of the instrumentation, the root canals were again irrigated with 1 milliliter RISA, which was left for at least 1 minute. The canals were finally flushed with 5 milliliter demineralized water. Then the well-being was assessed on the same day and after 24 hours by telephone. And also for the pain intensity, a visual analog scale was used at 0 to 5 days. The clinical and radiographic evaluations were performed at or more than 12 months. The well-being, occurrence of post-operative pain, and outcome were qualitatively reported. For the results, at the same day and after 24 hours, 14 out of 16 subjects, they felt good. 9 out of 16 also they presented post-operative intra or extraoral swelling, which was an unexpected adverse reaction. These swellings had the characteristics of edema. Most likely this was a symptom of the body's response to the high concentration of salts in order to regain homeostasis. No swellings developed into the abscesses, which also points toward the edema rather than the push out of contaminated debris. The frequency of post-operative pain equals to or more than 36, which means a week, and also it was 82.4%. On the same day, as you see, and also on day 1 and 2, post-operatively, there was more pain compared with preoperative pain. Also, the pain on day 1 and 2 was equal to the post-operative pain on the day of treatment. On the 3rd, 4th, and 5th days post-operatively, the post-operative pain was equal to the preoperative pain. 62.5% of the subject needed analgesics at day 0 to day 2. The recall rate was 94.1%, and the resolution of the apical periodontitis was observed in 87.5%. So to conclude, the well-being of subjects was good, and the overall post-operative pain intensity was low. However, the post-operative intra and extraoral swelling occurred often. And at the recall visit, the effectiveness of the root canal treatment with RIZA appeared high, which is 87.5%. The encouraging outcome results plus the fact that RIZA has a broader action range than sodium hypochlorite, which was done in vitro. They justify further work on the RIZA solution. To reduce postoperative swelling, it is advised to further investigate the optimal way of the application of RIZA in the laboratory before clinical application is recommended.